TopMedTalk.
Nick Margerrison here. Welcome to TopMedTalk's Fortnightly News Digest. In the military, forward surgical teams are deployed into challenging environments to deliver damage control surgery. They help people who've been injured, relieve the pain, stop the bleeding, patch the holes, and move them on to a safer environment. It's from this background that our two contributors on Monday's podcast come. Learn how they've been forced to innovate and what insights they can give to you, a practitioner working in a more familiar context. The podcast is called A Novel Use of the Erector Spinae Block in the Austere Environment. It was out on Monday. It features Desiree Chappell and Monty Mython with their guests Robert Fabich and also Sharad R. Green, talking about how they dealt with those difficult situations. So we began this fortnight on the 20th of January with part of our coverage of the American Association of Nurse Anaesthetists 2019 Annual Congress in Chicago. It's a piece about substance use disorder, peer support and empathetic information resource is the title. Desiree Chappell and Monty Mython with their guest Linda Stone and Rodrigo Garcia. Well worth listening to, very popular piece when we put it out live from the Congress and well worth repeating. So we highly recommend you have a listen to that. Very important topic, of course. Also, this fortnight, the Poet series came to an end. That means the full series is now available to download. It's an acronym, Poet, Perioperative Enhancement Teams, and it's about how you can enhance your perioperative practice. How can you facilitate more value-based care? What additional extras can you give to people who come to your institution? Also, special notice on the digest for Sunday special, being on the right side of the law. Find out about the Montgomery case and how it impacts on shared decision-making and consent. Oh, listen to that now.
The risk could have been avoided by caesarean section, but her obstetrician didn't discuss the risk with her, didn't give her the alternative of caesarean section, and in fact said that had she done so, she thought that Mrs. Montgomery would elect for caesarean section. But the obstetrician formed the view that that wasn't in Mrs. Montgomery's interests. So that's quite a paternalistic approach to advising patients. Sadly, the birth was complicated by shoulder dystocia. Her child was brain damaged and suffered a hypoxic injury and has cerebral palsy. She brought a case on her child's behalf, and the case ended up in the Supreme Court, and the Supreme Court took the opportunity to redefine what a doctor's duty is. Now, in the past, the duty had been to do what a responsible body of obstetricians would have done, or if you're talking about intensive care issues, what a responsible body of intensive care doctors would do. But the court said, no, when it comes to advising people, patients, it's not what a body of doctors would think is appropriate, it's what a reasonable patient like this patient would want to know. And in the Montgomery case, the court took the view that she would have wanted to know of the risk of shoulder dystocia, that she should have been empowered to make a decision as to what sort of birth she underwent, and that there was a breach of duty, therefore, in not offering her caesarean section.
Our guest Paul Sankey with Hugh Montgomery, Desiree Chappell and Monty Mython interviewing him in detail about how the law applies to you. Highly recommend that, the Sunday special, being on the right side of the law.
TopMedTalk.
It's Desiree Chappell here. Just a quick reminder, subscribe to TopMedTalk. We're a daily source of news and conversation focused on perioperative care. We bring you all the latest talk from all the major conferences in the perioperative space. We can also be found on Twitter, Facebook, LinkedIn, Instagram, and we now have a free mailing list with special offers and additional goodies for subscribers. Go check us out at TopMedTalk.com. That's www.topmedtalk.com.